Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, Steve Daly. It's Tuesday, August 26th. Today on HITshow, Advent International is acquiring PatientPoint, and in New York, the Attorney General has reached a settlement with MVP Health Plan over mental health access. We'll also look at OpenAI's bold healthcare expansion, Tempus consolidating AI and data, and the Sequoia Project keeping TEFCA on track. And we'll close on a bright note on pediatric cancer funding. We'll start with the provider landscape, where the story isn't about consolidation, it's about construction. Anika Shah has more on that story.
That's right, Steve. While hospital M&A has slowed dramatically with just 13 deals in the first half of this year compared to 31 in the same period last year, many health systems are looking to grow in other ways. The trend now is new builds and major expansions. National data shows healthcare construction spending is holding steady at about $69 billion annually, according to the U.S. Census Bureau. Rehabilitation hospitals are seeing the fastest growth. The number of inpatient rehab facilities has jumped nearly 70% since 2014, and construction in that segment hit 1.9 million square feet in the past year. And we're seeing headline-grabbing projects across the country. In Kansas, Advent Health opened a new hospital in Lenexa last month, with plans to nearly double its bed capacity in coming years. In Nebraska, a $2.2 billion, 550-bed tower is underway in Omaha. And in New York City, regulators just approved a $2 billion redevelopment of Lenox Hill Hospital, adding hundreds of private rooms.
So while mergers may be on pause, hospitals are still finding ways to expand footprint and capacity.
Exactly. Analysts say many systems see facility investment as a more controllable way to prepare for future demand, especially in fast-growing areas like rehabilitation, behavioral health, and specialty care, without the financial risk and scrutiny of M&A.
Now to patient engagement, where private equity is making another big move. Logan Stokes has the story.
Advent International has agreed to acquire PatientPoint, the point-of-care engagement company best known for its digital content and messaging platforms inside physician offices. PatientPoint's network spans more than 140,000 exam rooms and waiting areas nationwide, reaching over 750 million patient visits annually. The company offers a combination of digital screens, interactive technology, and data-driven messaging designed to influence the patient journey at the moment of care. PatientPoint says its platform improves provider communication, supports brand engagement, and helps close gaps in care. For Advent, one of the world's largest private equity investors, the deal is about scale. With this acquisition, they're betting that controlling influence at the point of care will be an increasingly valuable piece of healthcare's digital infrastructure.
Logan, what does this mean for providers who are already under pressure from payers and regulators?
It means they'll likely see more emphasis on digital integration within the clinic environment, tools that support patient education, medication adherence, and quality metrics. For private equity, it's also a foothold in shaping the consumer experience of healthcare, right where decisions are made.
So not just engagement for its own sake, but a potential lever for outcomes and ROI. Thanks, Logan. And that ties directly to today's regulatory headline. Teresa Vaughn has it.
New York Attorney General Letitia James announced a settlement with MVP Health Plan requiring them to fix inaccuracies in their mental health provider directories. Investigators found many listed providers weren't available or accepting patients, leaving families struggling to access care. MVP will now be required to verify directories, improve accuracy, and ensure patients can connect with real providers.
So from private equity expanding engagement tools to regulators demanding accountability, the common thread is improving access, particularly in mental health.
That's right. Both stories show how providers and payers are being pushed in very different ways to make mental health care more accessible.
From building new hospitals to reshaping patient engagement and access to mental health care, providers are navigating change on multiple fronts. But the real race may be happening in healthcare AI, with big players consolidating data and talent to stake their claim. We'll have that story after the break.
HITshow is made possible by Altera Digital Health's Sunrise EHR, the flexible solution that provides tools and technology clinicians need to deliver better care, their way. The journey toward the summit of healthcare has begun. And through partnerships built on trust, Sunrise is helping healthcare organizations bring next-level care within reach.
You're listening to HITshow Daily. Next up, all eyes are on AI. OpenAI is making its boldest move yet into healthcare. Peter Betterworth has the story.
That's right, Steve. OpenAI is no longer satisfied to be a general-purpose tool. The company has launched a dedicated healthcare division and has hired some heavy hitters to lead it, including Jeff Tangney, co-founder of Doximity, and Robbie Stein, a former Instagram product executive. OpenAI says the strategy is to build AI solutions tailored specifically for healthcare providers, not just adapting its existing models. Early plans include tools that could streamline clinical workflows, support physicians with real-time information at the point of care, and even generate patient education content in plain language. This comes at a time when health systems are under enormous pressure to improve efficiency without adding costs. Executives say if OpenAI can deliver AI that's safe, reliable, and HIPAA compliant, it could change how physicians interact with patients and how organizations think about clinical documentation.
So, Peter, this is a big shift from being a general AI platform to actually competing in healthcare's front yard.
Exactly. And it also signals that OpenAI wants to compete with entrenched players like Microsoft and Google, who already have healthcare AI footprints. By bringing in leaders with deep provider experience, they're betting they can close the credibility gap and win the trust of health systems.
And trust may be the deciding factor in whether providers actually adopt these tools. Thanks, Peter. Now to interoperability, where the Sequoia Project has secured another year leading TEFCA. Jade Romero reports.
The Department of Health and Human Services awarded the Sequoia Project the next option year on its contract to serve as the recognized coordinating entity for TEFCA. Since its December 2023 launch, TEFCA has grown to 10 qualified health information networks, connecting more than 9,400 organizations and exchanging nearly 40 million documents. CEO Marian Yeager told me in an interview today that Sequoia is focused on expanding participation with new exchange purposes and bringing in additional provider and payer groups over the coming year.
I think what it really represents is that this will serve as a foundation for health information sharing to support better care coordination for patients, to provide a much easier way for individuals to access their health information without having to go to a million different portals, supporting the ability for public health agencies to better access information. And importantly, and this is a really important milestone, is having payers engaged in nationwide health information sharing for a myriad of purposes.
So momentum is there, but plenty of work ahead. Thanks, Jade. And we'll close today with Nate Collier and some encouraging news from Atlanta.
The Peach Bowl Legacy Fund has committed $2.5 million to accelerate 18 pediatric cancer drug trials at Children's Healthcare of Atlanta. Leaders say the donation will shorten research timelines and bring promising therapies to children much faster. Gary Stokes, Peach Bowl CEO, said the goal is simple. We want every child battling cancer to have access to the very best treatments, and we don't want them to have to wait years for hope. Doctors at CHOA say the funding could cut months, even years, off the development timeline for certain therapies, potentially saving lives.
And Nate, that's not just about football dollars. That's about giving kids and families something priceless.
Exactly. For all the headlines about college sports, this is a reminder that the Peach Bowl's legacy extends far beyond the field.
That's the kind of story that makes you pause and say, wow, that's really great. Thanks, Nate. That's all the time we have for today. Thank you for joining us on HITshow. If you like these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. HITshow is made possible by Impulse, the new standard in health engagement. Impulse delivers personalized, consumer-centric experiences across the entire health journey. Trusted by over 400 organizations, Impulse drives better outcomes and business impact at scale. And by Kimchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you, Kimchi.com.